The Postgraduate School of Medicine in the East of England is responsible for training junior doctors in the physicianly specialties. So we have about 250 core medical trainees and currently about 450 higher specialty trainees, but that number is set to increase in the near future. Health Education East of England covers the areas from Hertfordshire and Essex in the south, stretching up through Bedfordshire and Cambridgeshire to Norfolk and Suffolk in the northeast. Within that area we have two large cities in Cambridge and Norwich, both of which have world-class universities.
At Health Education East of England, we're trying to train consultants and GPs who are going to be the best that we can possibly make them, and who are going to work within the East of England and really make a contribution to patient care.
I trained at Norwich Medical School and I loved it so much that I've not been able to leave Norfolk. So I did my foundation year training in, first of all, Great Yarmouth, the James Paget Hospital, and then the Norfolk and Norwich Hospital. And then I've stayed in Norwich for my core medical training. I hope to follow a career in cardiology, and the departments in Norwich have been beyond supportive, both helping me in research and also to get some hands-on training in the cath lab.
I trained in Oxford and I've always been very interested in gastroenterology and epidemiology, and I'd heard of a very famous epidemiological project that takes place in Norfolk, the European Prospective Investigation into Cancer, which was what prompted me to apply for an academic foundation programme in Norwich. Since then I've been working with him as my supervisor, and it's gone very well, and I've had the opportunity to present my work at important meetings such as the British Society of Gastroenterology.
After core medical training, which is a period of 2 years, they have the opportunity to then apply to a higher specialty. These include things like cardiology, respiratory medicine, gastroenterology, endocrinology and diabetes, geriatrics, as well as a lot of smaller specialties like clinical pharmacology, allergy, immunology and genetics.
I'm training in respiratory and general internal medicine in the East of England region, and I chose this region because of the breadth and wealth of opportunities available both in clinical and academic medicine, which takes place at some DGHs but also the tertiary centres, and in particular Papworth Hospital, which is an international centre of excellence for many different respiratory subspecialties.
One of the things that we're particularly good at in the East of England is simulation training. All of our core medical trainees get the opportunity of at least 1 day of practical skills training and a second day of working in acute medical scenarios. We run the largest programme for simulated acting up as a medical registrar, and most recently we've trialled the use of cadaveric material when trainees are practising practical procedures. One of the most exciting things that's happening at the moment is what we've called the repatriation project. So there are a number of posts, particularly in Hertfordshire, Bedfordshire and Essex, which are currently filled by trainees from London programmes. We're going to take those posts back into the East of England programmes.
The repatriation project over the last couple of years has led to the need to rebalance our programmes, and how we've managed to incorporate this is by creating more training posts in tertiary referral hospitals. So there's been quite a number of new posts in Norwich and Addenbrooke's, for example, and what that's led to is a much better kind of trainee experience and higher training in particular.
The jewel in the crown of the East of England is the Biomedical Campus around Addenbrooke's Hospital, and trainees that come to this region will have the benefit of working in a world-class institution.
The Cambridge Biomedical Campus is something that we try and give exposure to most of our trainees. It is the world-leading centre for genomics and for gene therapy, cell biology, and to see that translated into real-life clinical care is extraordinary.
As an academic clinical fellow in medicine, the East of England is a fantastically exciting place to be, with the expansion of the Biomedical Campus on Addenbrooke site. With it's brought lots of fantastic facilities, and I've really felt the benefits of the close links and networks between different labs, institutes and industry itself. So I do feel very privileged to be here.
We like to give our trainees in East of England other opportunities. It's not just about academic training and clinical training. We give people opportunities in leadership training, working with the Judge Business School as part of Cambridge University. We're part of the clinical entrepreneur programme, allowing people to take a flexible approach to develop new technologies and new commercial interests alongside their medical training. We're very keen on allowing trainees to develop experience in education. We support them to do certificates in medical education and up to master's level study. We want to train leaders and educators of the future. My personal passion as Dean is around global health, and I love to give up trainees opportunities to work in developing countries. We've got well-established schemes in sub-Saharan Africa, in KwaZulu-Natal and the Eastern Cape, allowing people to make a real contribution to third world healthcare. Trainees come back from global health placements with a huge amount of clinical knowledge, but alongside that, leadership, self-resilience, transformational sort of skills, which we exploit shamelessly and bring into the NHS. They're the people who are going to be the leaders of the future.
The East of England is already a great place to live and work, and we genuinely believe that it's going to get even better over the next few years. So if you're looking for somewhere exciting and supportive to come and train, we'd be delighted if you would join us.